I'm sure everybody has been disturbed by the amount of negative and in many cases vitriolic media and commentary that has been produced over the last few days, particularly in the social media environment.
UnitedHealthcare is still very much dealing with the fallout from the assassination of its CEO, Brian Thompson. Now, the company is being sued by a group of its own shareholders who allege that the company misled them by not adjusting its forecasts following the loss of its CEO. And that's all anything comes down to, right? The shareholders have to be happy. Someone dies, the shareholders are the ones who need to be appeased. In a capitalistic society, one of the most powerful things you can be is a shareholder. The lawsuit was filed Wednesday in a U.S. District Court for the Southern District of New York, and it's seeking class action status. The suit accuses UnitedHealthcare of not initially adjusting its forecasted net earnings for 2025 in the wake of Thompson's death. Thompson was killed on December 4th of last year, and just the day before, the company had announced its forecast for the coming year. However, despite the backlash the company received following the incident, they announced on January 16th that the forecasted numbers from December 3rd were still good. And at the time, that was a little suspect. It wasn't just that the company was scrambling without its CEO. The company was also grappling with some really bad press. They were essentially in a PR crisis. Rather than empathizing with UnitedHealthcare and mourning the loss of its CEO, rather than taking the bait that we're all expected to, the bait that usually suffices to quell any legitimate criticisms of the bigger picture, because no one wants to be the guy to disparage the dead or to be accused of using a tragedy opportunistically. Social media and news networks were focused on all of the reasons why the general public could possibly be generally disgruntled with the healthcare industry. There was also plenty of commentary about how the general public just couldn't be bothered to care about one millionaire or billionaire's death when so many of us had died because of the completely predatory way that the CEO's company chose to do business. How come none of those deaths were making headlines the way that this one was? Were those deaths any less murderous than what Luigi did just because the trigger that was pulled happened in a boardroom somewhere? People were tired of giving money to already wealthy people who give so little back in exchange. People were tired of paying into companies that pride themselves in finding ways to legally defraud their customers. Because the customers don't matter. The shareholders matter, but UnitedHealthcare found a way to upset even them. The projected forecast for 2025 that was announced the day before Thompson's death and maintained a month and a half later included net earnings of $28.15 to $28.65 per share and adjusted net earnings of $29.50 to $30 per share. The investors said in the suit that those projections in January were materially false and misleading for basically all the reasons that I went through earlier. And the shareholders, ever the compassionate bunch, said that since there were so many eyes on the company and on the broader healthcare industry, UnitedHealthcare was no longer willing to use the aggressive anti-consumer tactics that it would need to achieve $28.15 to $28.65 in earnings per share or $29.50 to $30 in adjusted net earnings per share. As such, the company was deliberately reckless in doubling down on its previously issued guidance. Anti-consumer tactics. Let that one soak in.
I have never been more proud of this company and our colleagues and what this company does on behalf of people in need across the country.
Now let's be fair. The shareholders aren't outwardly advocating for anti-consumer tactics, which are exactly what they sound like. They're saying that the company was already using anti-consumer tactics when it made its projections. When the company pivoted away from using those anti-consumer tactics after the consumers found out about them, the shareholders are saying that UnitedHealthcare should have adjusted its projections in according to its new, less aggressive strategies. So here's what they said in the complaint. Specifically, defendants made false and/or misleading statements and/or failed to disclose that UnitedHealth had for years engaged in a corporate strategy of denying health coverage in order to boost its profits and ultimately its share price. This anti-consumer and at times unlawful strategy resulted in regulatory scrutiny as well as public angst against UnitedHealth, which ultimately resulted in the murder of Brian Thompson. And I want to point out very quickly that we're talking about healthcare here, and in healthcare, the so-called consumers are actually medical patients. I really don't understand how people still manage to defend the healthcare and the health insurance industries in this country. They literally don't see us as people who have rights to healthcare, and they remind us of this time and time again. But back to the shareholders, while they weren't outwardly advocating for the use of anti-consumer tactics, they certainly bought into them, literally. They invested in the company knowing that the company was already using said anti-consumer and at times illegal tactics, and they supported the company's 2025 projections knowing that those projections were based on the use of those anti-consumer and illegal tactics. There is no balance in capitalism when it's completely unregulated and unscrutinized, when the bottom line is the only thing that matters. In that way, to be an investor is to be anti-consumer. A company can choose to prioritize either the investor or the consumer, or in this case, the patient. The company gets some money from the consumer/patient, but they're also expected to provide a service in exchange for that money. This costs the company money, so the company is constantly trying to deliver less to the consumer/patient while charging more to widen its margins. Wider margins mean happier shareholders, smaller margins mean happier consumers/patients. And shareholders, with the money they invest into these companies, they are entitled to their monetary returns. More than people paying for healthcare are entitled to receive that healthcare, apparently. There is no happy medium, there is no middle ground. Perhaps there could be, but there isn't. And these shareholders knew exactly what they were buying into, and they're so entitled to their monetary returns that they're now willing to sue over them. UnitedHealthcare denies any wrongdoing and intends to fight the lawsuit, even though the investors are currently seeking unspecified damages. Perhaps if and when this thing achieves class action status, damages will then be specified. Also, UnitedHealthcare did adjust its 2025 projections, but not until last month. The company said it needed to shift its corporate strategy, and that same day, April 17th, its stock dropped more than 22%. So we'll see how this all turns out, but either way, the average consumer, who again is a healthcare patient, is losing. But in the meantime, we can at least celebrate a little bit more bad press for UnitedHealthcare, all right? That's it for me. If you got anything out of this, please like the video and subscribe to the channel for more. Thanks.